Earlier this week, we had on a woman who suffers from Lyme disease. After not getting the proper diagnosis or treatment here in British Columbia, she traveled to the U.S. to get the help she needed. A very costly course of treatment. What is Lyme disease? Why does it not get diagnosed here in BC? Are doctors ill-prepared to treat the disease? We thought we'd look at this a little more closely. I want to bring in Dr. David Patrick. He's an epidemiologist and the director of the UBC School of Population and Public Health. Dr. Patrick, hello.
Hi, Aaron. How are you?
I am good. Thank you for taking the time on a Friday night to talk to us.
A pleasure.
I read an article you wrote about Lyme disease and how it gets diagnosed. Why don't we start from the beginning? What is it?
So Lyme disease is a bacterial infection that's transmitted from a blackleg tick to a human being. And if it's undiagnosed, it can lead to initially a rash, later on arthritis, neurological complications and things. So it can be pretty serious when it happens. It must be diagnosed properly. That said, Aaron, there's a great deal of confusion about how to properly diagnose Lyme disease.
And this is what I'm sensing. There are people who are quite sick, who have no other possible explanation for their diagnosis, and they're convinced they have Lyme disease, but the medical community doesn't necessarily agree. Why is that?
Well, I think what you have to do is take a good look at, first of all, these people are sick, and I think it's really important that we work very hard using newer technologies to get to the bottom of what's really happening. But perhaps I should explain for you why most of the medical community and most of the scientific community is not buying these alternative Lyme tests that are being offered from for-profit labs in the United States.
Yeah, that's what we got to with our guest earlier this week. She said she couldn't get the diagnosis. She got negative tests here in Canada, and then she was in Los Angeles and got a positive test, and using different methods. So how does that work?
So Brian Fallon, who is a very Lyme-friendly doc from Columbia University in New York, published a definitive study on these alternative tests late last year. What Brian found was two very important things that your viewers should know. First of all, these alternative tests did not pick up Lyme disease any more effectively than the tests you can get down the road at the BC Centre for Disease Control or the National Microbiology Lab in Winnipeg. So that's important. But the second thing he found was rather astounding. One of these labs that uses its own in-house criteria for diagnosis, and we know that a lot of folks in BC use such labs. One of these labs, they were tested against 40 people who definitely didn't have Lyme disease, healthy controls. This lab labeled 23 out of 40 people as having Lyme disease, Aaron. I could flip a coin and give you more accuracy than that.
Wow. That is dangerous, just misdiagnosing, possibly. Right.
Now, I gave you a picture with stickmen on it, and
yep.
I'm wondering if I can speak to that.
Yeah, sure. We'll put that up for you right now.
Okay. So if the picture is up, you've got 100 British Columbians there who might be testing for Lyme disease. Now, in our experience, about 2 in 1,000 will test positive for Lyme disease, but we're going to give you 1%, just to say there's a lot of underdiagnosis going on. So that green person there is the person with Lyme disease. The alternate test is probably going to pick this guy up. That's the good part, right? Now, all the people there in black, there's the problem. That's the 56 or 57 out of 100 who are told they have Lyme disease who do not. Okay, once again, you could flip a coin and have more accuracy. Put another way, if you take a look at all the people who have a positive test from this lab, 56 times out of 57, 57 times out of 58, it's not the answer, Aaron.
So what is it? What are these people suffering from if they don't have Lyme disease?
Well, the interesting thing is the symptom complex that we're seeing there in our own studies is pretty well identical to what we're seeing in people with chronic fatigue syndrome. That's not an answer either, but the symptoms are bad fatigue, bad body pain, often a number of neurological things, inability to concentrate, and that kind of thing. The thing that we really want to do with both these groups, chronic fatigue and the folks who may have been misled into thinking they have Lyme disease, is to use some newly available technology that can really allow us to dig deep into what is a more plausible series of explanations.
And this idea that there's so many false positives must provide a great deal of hope or confusion for the people that have this false positive test, and it must sort of feed back on itself.
Yeah. So I think people really are glad to get a positive test because they've been looking for an answer for so long. I mean, you can't forget, the outrage that people have is pretty well justified. They've been bouncing from specialist to specialist without an answer for a long time. And that's why in BC we're working on having clinics that work very hard at solving why these symptoms are happening for people, and studies that are doing that as well. But if you go to the second picture I have for you, I think this idea of it feeding back is really, really possible. I mean, goodwill all around. Nice people in a lab, and it's no problem. Lots of people in a lab will do tests for profit. That's at the top. Now, those guys do sponsor meetings that are attended by Lyme disease advocates, and that's a nice thing that they're doing. It's more than likely going to make the advocates feel favorably about the testing company, maybe recommend the test to people. And then if people go ahead and test, what you're going to have is 57 times out of 58 a false positive. So one person who's got Lyme disease might be joined by 57 or 58 other sick people thinking they've got Lyme disease. This takes a modest problem that we have in BC and blows it way out of proportion into a huge epidemic. And it's probably good for business for these labs.
I have been reading, however, that the bacteria that is responsible for Lyme disease is one of the fastest growing vectors of disease in North America.
Correct. And you've got to look at the fact that North America is a whole bunch of different ecosystems. If you were in the Niagara Peninsula right now, you'd be seeing a big onslaught of Lyme disease coming in from ticks, maybe 50% of ticks, up to 50% of ticks actually carrying the bacterium. Now, fresh data from BC, all over southern BC, and from ticks collected from British Columbians paints a very different story. Using very sensitive tests that can pick up all the strains of Lyme bacteria that people are worried about, we are finding Lyme disease in only 1 in 200 black-legged ticks in British Columbia. That's a very different risk assessment, Aaron.
And then at the end of the day, as we have mentioned, there are sick people who have no answers, and that's what you're trying to find for them.
Yeah, so in the last 5 years, there's been major technological breakthroughs that allow us to look at things in completely different ways. Through the rapid movements in gene sequencing technologies, we can look at a specimen and we can describe every last microbe that's in that specimen. So we're not playing 20 questions anymore and saying, is it Borrelia? Is it chlamydia? We can actually look at the whole picture. Another technology that we can look at your whole history of infection by taking a look at all the antibodies that you produce. And that's new news in the last couple of months. And finally, we can use similar technologies to take a look globally at the genes being expressed in patients suffering these symptoms. And that gives us a way of describing what's going on with the immune system that we've never had before. So I think the challenge for the Lyme advocates and for ourselves as scientists is to back away from the quick, easy, dirty answer that's probably wrong and dig deep, find out what's really going on.
All right. We have to leave it there. We're flat out of time. I do want to thank you for yours. Dr. David Patrick is the director of the School of Population and Public Health at UBC. We're talking Lyme disease tonight. Good night.
Good night, Aaron.